Hey Buckeyes, there's something you need to know. The drug landscape is rapidly changing. So it's important that you hear this message because you could help save a life by learning how to respond to an opioid overdose. Opioids are a class of drugs that include heroin, fentanyl, prescription pain medications, and many others. Opioids can be addictive, extremely powerful, and even deadly. Synthetic opioids, the most common being fentanyl, are being found in drug supplies across the U.S. Fentanyl is 100 times stronger than regular opioids, and it's been seen close to home in our own campus community. Fentanyl and other harmful contaminants are being added to drugs because of its extreme potency. Fentanyl is often added to powders like cocaine, capsules, pressed pills meant to look like prescription medications like Xanax or Adderall, and many other drugs. It's important to remember that any pill or drug sold on the internet, on the streets, or by a person you know could contain a potentially lethal contaminant. If a person is exposed to an excessive amount of an opioid, they can overdose, which can cause severe injury or death. An overdose usually occurs within 1 to 3 hours after using the drug. Here are some signs to determine if someone may be experiencing an overdose. Cannot be woken up or not moving. Breathing slow or absent. Dizziness and disorientation. Discoloration of lips and nails. Extremely small pupils. Choking or coughing, gurgling or snoring sounds. Cold or clammy skin. If you think someone is overdosing, shout the person's name and shake their shoulders. If no response, rub your knuckles on the center bone of their chest. Call 911 and prepare to administer naloxone. Naloxone, also known by the brand name Narcan, is a life-saving drug that can reverse an opioid overdose. Naloxone works by blocking the effects of opiates on the brain and by restoring breathing. Naloxone only works if a person has opioids in their system. Naloxone will not cause harm if administered to somebody who turns out not to be experiencing an opioid overdose. Follow these steps when giving naloxone nasal spray. 1. Make sure the person is laying on their back. 2. Hold the spray. Put your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. 3. Place the tip of the nozzle into one nostril so that your fingers are against the bottom of the nose. 4. Press the plunger firmly to give the dose of the spray. 5. Remove from the nose. 6. Stay with the person after administering naloxone. If the person starts to breathe on their own, roll them onto their side. If the person does not begin to breathe on their own after 2 to 3 minutes, give another dose of naloxone if available. Stay with the person until help arrives. Naloxone is never a substitute for emergency medical care. It is important to call 911 even if the person responds to the initial naloxone dose. A person can go back into overdose after the medication wears off. If there is no naloxone present, you should still call 911 and wait with them until the first responders arrive. Remember, the university's amnesty policy and Ohio's Good Samaritan laws are on your side. These are policies and laws meant to protect individuals who do the right thing and take action. Naloxone is available at no cost on campus at Wills Student Health Center. For a complete list of locations, visit go.osu.edu/ATOD resources. If you are concerned about yourself or someone you know who may be misusing alcohol, tobacco, or other drugs, know that there are staff and programs that can help. To learn more about these services, visit go.osu.edu/ATOD resources. If you've made the decision to use drugs in the past, the healthiest choice you can make is to stop using. If you do decide to use again, here are 3 things to consider. Only use drugs if you're familiar with the source, and only take medications that you know came from a pharmacy. Counterfeit pills can look just like the real thing. If you decide to use drugs, test them for contaminants. Information on drug test strips is available at go.osu.edu/ATOD resources. Never use alone. It is important to have others nearby that can call 911 and administer naloxone.